Okay, so this next session is about how to conduct a clinical assessment. So we've spoken about how important it is to do the Davis interview structure technique, logging on, what's the most important thing I can do for you today, conducting the assessment, and then logging off and then preparing for those assessments. So we're now going to have a look at what it is that you're actually going to do. And again, there are lots of nice guidelines around this. So we're going to start off with the competency framework. And this is how we assess. So we obviously have the time and the patient's name, and we're going to write just some basic things about what we're seeing. So the colour of their skin. And the colour of the skin obviously gives you a lot of information about what's going on. So we know normally if people are looking a bit pale, they could be anemic, maybe their lack of iron or etc. Breathing. You know, we know from our previous assessments, breathing is the most priority. So we're going to just talk about how they're breathing. And then their mobility, what we saw and how they got up. We're going to use any of the cues that we've got. So as we're watching somebody and talking to somebody, we're going to get all of this stuff. We do not record all what we have interpreted or what we've picked up. So basically what we're doing, when we assess a patient, we're doing it very holistic and we're just looking at everything around us. So what does their skin look like? Are they breathing in and out? What was their mobility like? And it's just this big holistic observation. So it's an observation on how we assess. Now, the irony of the observation on how we assess is the fact that this is the same assessment that the Department for Working and Pensions do. So when a PIP assessor, who is normally a nurse, does an assessment, this is the same assessment that they do. And ironically, what people do in the PIP assessment, that's the personal dependent one, they'll walk to the assessment centre, walk in and then start to limp. The reality is if you've just now got to your assessment centre, actually your mobility is reasonably good. If you've been able to walk into a room in front of me, you are able to walk. And it's all of this stuff that as a nurse and assistant practitioners, we're going to be picking up on. Okay, so it's all the things that we're going to be looking at. So what we do is we carry out comprehensive, systematic nursing assessments. From that systematic assessment, we plan, deliver and evaluate safe, competent, person-centred care. So the systematic assessment starts from head down to toes, and runs through all of the areas in which we've looked at, the activities of daily living and those other areas around physical health and mental health. You're going to generate information to make a decision or a plan. So you may decide at the end of the assessment that they don't need anything. It may be that actually, look, this is all good, or you may decide that a plan is needed. And both of those require the same amount of clinical judgment. So your clinical judgment is based upon your observation and based upon the assessment tools in which you've used. So it forms the basis for the planning and implementing the care plans. So whatever you have done the assessment on, if it's come up with a risk, you're going to come up with a care plan. If there isn't a risk, you're going to leave it well alone. And it allows us to identify needs and preferences. And at this point, if you are doing all of these assessments, it's got to be personal centered, right? We don't need to go into realms of let's make this individualized. It naturally will be. And by doing so, you're going to get it right, because actually you can't get it wrong if you're going to be using assessment tools. So the holistic assessment, the term holistic comes from the Greek word meaning all and the entire word of total. So that's what we mean. And again, we're looking at psychological, spiritual, social, and aspects of the person's life, which they're all integrated. We need to be able to be adaptable and flexible in a variety of circumstances. So that's just taking into account what's going on behind us and what's in front of us. So us making a judgment based on everything, not just what we're seeing. The language and the terminology used needs to be appropriate to the audience. So again, for those in dementia care, we're going to keep it very short, maybe 1 or 2 sentences. For other areas, we're going to keep it language appropriate. So if they have got good cognition, we're going to be able to do that and just talk as we were. You're going to accommodate the diversity of the individual for their beliefs, values, and circumstances. And equally, we can just get that from that very first, just tell me a little bit about yourself. And people will generally just talk about who they are. And if you want a bit more, you can just start doing that 7 whys. Oh, that's really interesting. Can you tell me a bit more about that? And actually the trick here is to filter your questions. So we normally start off with a nice open question. What brings you here today? They start talking and you can start saying things such as, tell me a bit about that. Where has that come from? And you can start to filter. So we use open technique questions and then filter techniques. And then finally, we'll do closed technique questions. So yes or no answers if we just want to summarize something. And as we're going through the assessment, we're going to be using those active listening skills. So when I mean active listening skills, as you're talking to me and as the person doing the assessment, I'm going to be saying things such as, oh, that's a really interesting point. Or just to be sure, is this what you meant? So I'm going to paraphrase things back and repeat things back to them, just so I know that what I'm hearing is right. And if we look at your communication in your professional discussion, you have to talk about Sharon and Weaver's communication assessment methods. And Sharon and Weaver talk about the sender and the receiver of information. And in an assessment, I'm going to be sending you information and I want to be receiving it. And we have to make sure that we're both on the same page. So Sharon and Weaver's communication theory is all about, I'm going to ask you something as the sender, I'm going to receive it back, and I'm going to use those active listening techniques to repeat it back. And equally, you could use Egan's theory of communication, the SOLAR, the sitting, open, leaning, and repeating and reflecting as another form around approach assessments. And again, we must make sure that we're taking in views of parents and families and carers, because the reality is we don't know if what we're being told is to be truthful. So again, not necessarily that people are lying, but different perceptions, because people see things in different ways. It doesn't necessarily mean they're lying. When we do an assessment, each assessment that we undertake, we must get consent from them. And as we get those consents, it's really important that we do that. Can you all see my screen, by the way?
Yes.
Yeah.
Okay. I'm just slightly worried that nobody could see that. So it's important then that we get consent, that we work alongside the multidisciplinary team to making sure that everyone's involved to make the plan. We obviously work together to identify what the problems are, because again, what's the problem to that individual may not be what the problem is to the families. And then again, at the end of our assessment, we're going to come together to create those goals. So when we undertake an assessment, we must use approved assessment tools, and we must use that nursing process. So that's the planning, collecting, and reviewing and evaluating. We must use the systematic approach. So our systematic approach is the activities of daily living. And again, I've put a theory and some research in there for you. It's from the Isle of Wight NHS, and they now use the activities of daily living as an integrated part of the assessment process. And that's all the stuff that you do in your normal care plans: walking, mobility, food, drink, fluid. But again, it's really important that you do cover all of this. So the systematic approach must include communication, breathing, eating and drinking, elimination, personal hygiene, controlling body temperatures, sleeping, mobility, sexuality, and dying. Okay, so that's the minimum in what we should be assessing for in a care plan. So when we do the activities of daily living, when we write a care plan for somebody, these are the minimum areas in which we should be doing. Okay, so when CQC come out, they're going to be looking to see that you're meeting the activities of the daily living, and that's where we need to be. So communication, breathing, eating, drinking, elimination, personal hygiene, dressing, controlling body temperature, sleeping, mobility, and expressive sexuality, and dying. And when we get to the end of the assessment, we need to be supportive, So we need to be assessing, is this fit for purpose? Is it going to work for them? Does it do that re-ablement bit, which somebody at the very beginning talked about? Does it maximize independence? Have we got the psychoeducation? Have we got the health promotion in there? What can we do? How can you better yourself? Life enhancing. Does this improve the activities of daily living? And then you've got your care delivery. Okay, so that's the outcome. So when we look at the outcome, this is what we're looking for. The nursing process identifies the patient's needs. It looks at the goals and the care that needs to be provided, plan the care to provide around the patient and families, and obviously needs to be evaluated for its effectiveness of care. So again, that's that review process when we go in. Okay. And again, you can see that it's not a quick checklist. So step one, collect information about parents and about the patient's current conditions. So we can just do a holistic questionnaire, tell me a bit about your past, tell me why you're here today, what is it that's brought you here? And we can get that direct from the patient, or we can get that from family members. Alternatively, you may have other assessment tools there. From that, you are going to identify nursing needs of critical analysis of information. So as you're going through that information, you're going to highlight the key points. And from those key points, you will identify the right nursing assessment tools that matches up to the care needs. For everything you identify, you must ask why. So if you're saying, I've had an eating problem, why? What's the underlying cause? And it's exploring that underlying cause. So for example, we know people with eating problems, it's not necessarily the fact they've got an eating problem. By the time you drill it down, it's because they've got a pain in their tooth. Or maybe it's just food that they don't like. It doesn't necessarily mean that they've got an eating problem. So if somebody says, oh, I can't eat, why can't you eat? Oh, I have trouble swallowing. Oh, why do you have trouble swallowing? I can't chew it properly. Okay, why can't you chew it properly? Oh, I've got dentures. Okay, so what's the problem with the dentures? Oh, they don't fit properly. That's the problem. And it just takes all of those whys to get to that root cause problem. So actually, you don't have an eating problem, you've got a denture problem. And if we solve the denture problem, you should be able to eat. And it's just that being curious. And the wonderful thing about nursing is we don't accept anything. We just keep digging and digging and digging. It's part of our role. We're murder mystery people. We're the inspectors. We just keep going in and asking why. So again, if someone is falling, why? Is it the footwear? Is it the equipment? Is it the medication? Is it an underlying health condition? And just keep digging until you've got to where you need to be. Once we've got that, you're going to critically think and add clinical judgment. So once you've identified the problem, you come up with the goals. So how are we going to solve this? So if it's dentures, great. Should we get you a dentist? Should we look at your oral hygiene plan? Should we look at maybe a dentist coming here? What can we do to fix that? After that, these inform the nursing's actions to deliver the care to achieve these outcomes. So nursing interventions are very short. We don't want big goals. We want nice short goals which have clear, measurable outcomes. Because the reality is, if we leave it too big, it becomes too ambiguous and too hard for us to track and follow. What we need to be doing is working on all of these small problems, which then creates the big picture. From there, step 3, we're going to design the nursing care to meet the goals. So once we've come up with the plan and we've come up with the assessment tools, we then need to say, how are we going to get there? So is it a new set of dentures? Now, in reality, that sounds quite simple, doesn't it? The problem we've got is, are there dentists? How much is it going to cost? Who's going to pay for it? So the problem that we have is we're frustrated in care because we come up with the problems and then there's no solution because it's going to cost. And actually, it's not there. We can't meet those needs. We'll evaluate it from the patients progress towards their goals or desired outcomes. And again, we'll talk about desired outcomes later because that's either outcome focused care. We'll evaluate the effectiveness of the care provided. So that's when we do a care review. We go back to the goals and obviously do that. And we'll describe and document the progress to date and undertake a final evaluation. So that's where we go back, and at that final evaluation, all those progresses is where we would probably reassess. So what we would like to see for a health improvement is your score today was 14, but in 3 weeks, 4 weeks time, you've been taking your medication, your score is now 8. So we can see that progress and the scores lowering, and therefore the risks being removed. And at that point, we can say the nursing interventions were fine. Everything's working, it's all going the right way. What would we do if the score didn't move? So we've evaluated it. What would we do if the score doesn't move? Anyone? Like, if we keep quiet long enough, he's going to tell us.
What we can do to improve.
Yeah, so let's say, for example, we've done a score and the score was 15 in a previous assessment. We've gone back, we've evaluated it, the score is still 15 at the review point, so they haven't improved. What would we do?
And try and find another way to
Absolutely.
meet their goals.
Another way, because it means it hasn't worked. So the
make a plan.
madness is doing the same thing over and over again and expecting a different outcome. If it hasn't worked, reevaluate, look at a different approach and try it. Because we're not in a one-hat-fits-all situation, are we? And the reality is, it's that courage in trying new techniques. You know, just because this has worked for one patient doesn't mean it's going to work for all. And actually, the evidence has suggested there has been no improvement. Therefore, the plan is not working. Change it, change the outcome, change the plan. You know, we need that score to either come down or go up, depending on what the assessment tool is. And if it's not working, change it. You know, let's make it more person-centered. And what we're going to do is we're going to do the 7 whys. Why hasn't that changed? Why hasn't that worked? Because actually, it normally does work. And it may be the fact you've got the wrong medication. It may be the fact that your nursing intervention isn't the right nursing intervention. So change it. I can't say how many times I've seen nursing plans at 6 months and there's been no improvement. So what's the point? You know, we need to see improvements in care, don't we? Equally, we could work with a multidisciplinary team, can't we? So it may be the fact that this isn't working. We need that additional expertise. Maybe at this point, if it is maybe the teeth and we need a dentist, do we need a dietitian as well? Is there an underlying problem here? You know, what more can we explore to try and get this goal achieved? So just making sure that you've got the right professional at the right times. And ensuring that accountability is being shared across a multidisciplinary team. You know, the reality is just because somebody is in your care doesn't mean that you are the experts in all areas. And there is this, and this is my personal belief, there is this thing that once people hit care homes, everyone backs off and you kind of feel like you're on your own a bit. I don't know if it's still the case, but it definitely feels like that when I've run care services. Does it feel like that still at the moment, or do you feel well supported?
Sometimes I do.
Yeah, and that's an honest feeling, you know. But the reality is, what you're going to do, you're going to do your SABAR, which is your nursing assessment tool. So what was SABAR? Who can remember?
It's the situation, background,
assessment.
And recommendation.
Perfect. Yeah. So again, if it's not working, you're going to come up with your SABAR report. Look, this is where we're at. Because ultimately, when CQC comes in, they're going to say, what did you do? And you can say, well, look, here was my SABAR. This was the background. This is what it was. This is the assessment that I did. And these were my recommendations. And actually, if it's out of your hands, it's out of your hands, isn't it? But you've done everything in line with NICE guidelines and clinical judgments. There we go. We've already done that one. So accountability. So nurses have professional accountability and responsibility for the assessment, planning, and evaluation of care. And that's, again, as assistant practitioners, you have exactly the same. You need to ensure those that you delegate with have the appropriate skills and knowledge. So if you are going to come up with a nursing intervention, or something outside the ordinary, you need to make sure that your team understands the care plan and that they can deliver it. The NMC code states, so again, as assistant practitioners, you have your NMC code of practice. You must make clear and accurate records of the decisions of the assessments you have made, the treatments and medications you have given, and the effects that they have been. So in our codes of practice, it clearly says we are accountable if we conduct an assessment and we have the tools and we have the recommendations and the treatments. It's down to us to make sure we're tracking it and monitoring it. Ongoing process. Assessment isn't a one-off activity. We are responsible and accountable for making this a dynamic, ongoing process. So again, if it doesn't work, change it. If you need somebody else in the room, ask for it, because we're not all experts in all areas. And obviously, it needs to be encompassing and responsive to the patient's needs of change. So therefore, just because we say we're going to review it in 3 months or 6 months' time, if their health need changes, we would change it in line with their health needs, wouldn't we? We wouldn't just wait until that time comes up. We would change it as we need. It's equally important that we observe, discuss, and plans identify as further needs to investigate is accurately recorded so we can contribute to the effectiveness of compassionate care. So in other words, just make sure your assessments are done on time, that they're uploaded, or they're put in care plans, and they're obviously shared with the right people. And equally, it sounds like a lot of work. It's not. Once you've done the assessments, things actually become a little bit easier because you've got the audit trail is there. It's just you're maintaining it and reviewing it. And remember, everything you write represents the care that you give. Therefore, it needs to be clear, accurate, professional, and ethical. But we know that. So are there any questions on the assessment process? Or are we happy with that? All happy? Speak now or forever hold your peace.
Yeah, we're all right.
Marvellous. Okay. So I'm just going to stop that there for a second and go on to the next slide.